something to go in conjunction with my YouTube video so you understood what papers I'm using when I am actually up there lecturing. And so as I get to each section, and the reason I have 12 short videos is because it's an active learning process, and I usually do this in the lab. So this would be for students that maybe couldn't make it or that need a review. So one of my first pages I talk about is the nursing process, is the assessment, and I review through the assessment piece and talk about that in video number 1 and kind of get them acclimated to my handouts. Okay. Then I go into the first piece of the nursing process after assessment, the second piece, which is the nursing diagnosis. And on page 2, I talk about my different types of nursing diagnosis, looking at problem focus, risk nursing diagnosis, and health promotion. And then I'm using, in conjunction with this, whatever nursing process book the students have to work with them to show them how to use that book and how to develop that nursing process. So this is page 2. And I'm going through teaching them about the different types of nursing process. And then in page 3 is the problem etiology, symptom or defining characteristic statement that is a part of the nursing diagnosis piece. So from here I talk about that, and then I'm going to move into an activity. If you're following my videos, where I think I doesn't do a very good job of telling them what to do, for some reason it didn't get put on the video, where I'm going to have the students highlight and go through this case study and kind of underline or highlight the defining characteristics, the signs and symptoms that they're seeing with this particular patient in this case study. Okay. Then it goes on to another video, and I spend a lot of time on nursing diagnosis. Goes into another video where after they have gone through and highlighted out these materials, the signs and symptoms, then they're going to go through, and on number 1 here, they're going to list any additional information that's missing from the case study, other questions that they would want to ask during their assessment. Okay, so then I stop the video and have students do that. Then from there, I teach them to take the information that they've obtained from the case study, look at the data, and cluster them either in clouds or in lists, depending on the type of learner that they are, and cluster them under things like such as respiratory problems or blood sugar problems or pain or whatever it is that they're exhibiting. So I have them do that, and then the next step is I have them go and find areas of concern in their nursing diagnosis book. So using the nursing care plan book to help them identify a list of potential diagnoses. And so I get them to go under, for example, in my case study, it's about COPD, so I would have them look under COPD, look at the potential nursing diagnosis, and just do a random brainstorming type of list down that I have them list on here to kind of guide them in the direction we want them to go as they're learning the nursing process. So once they get their list, then I start, you'll notice my videos, I come back together in my videos, and then I talk about prioritization. Okay, this is my other handout. And if you're watching this and you're not from my school, I'll be happy to email this stuff to you. Just contact me on YouTube. But this is my list of prioritizing. So then I talk about Maslow's, and I talk about high, intermediate, low, and then I talk about getting them to take that list of nursing diagnoses that they have gathered on page 4 and begin listing them out in priority order on this particular sheet. So they're going to list, all they're listing right now is this diagnosis label. I'm not worried about the related to or defining characteristics just yet. Okay, and then in another video, I go back and I talk about my list of priority in conjunction with theirs. Talk about, why certain things are important and certain things are not important. Okay, and so then from there, I go into talking about the related tos and the defining characteristics and getting them to look in their books and write down the related tos that relate to their patients, and then also the defining characteristics or signs and symptoms that are in conjunction with their patient that they're looking at. And then as you follow along, if you follow along with my videos, I'll talk about the nursing process being a cyclical process. And then I get into talking about its revolving and things like that. And then I go into talk about the plan part of the nursing process, specifically the outcomes and goal development, and looking at SMART goals. And so you'll see that pattern in my lectures when I talk about that with the students. And then continuing on with the plan, I continue to talk about the developing of the interventions, okay? And then the implementation piece, when we actually, the different types of interventions that we have. So I'm moving along into the nursing process. And then I talk about evaluation as well. Okay, and so this is where then I stop and we take the very first nursing diagnosis that the students have on their list of priorities. And I have them write it across the top. I have them do their related tos and their defining characteristics. And then I work with them on that first nursing process or nursing diagnosis to list out their outcomes, and I reinforce the specifics of the SMART goals as we're writing those in here. And then I have them go into their books and look at interventions that relate to what's going on with the patient, as well as the rationales. I interject that everything has to point back to the problem itself. Okay, that we as nurses are going to modify this problem for the patient or assist them to modify their problem. And then I also have them, and we go through and we write out an evaluation, whether it be met, not met. If it's not met, what are we doing to modify that plan of care? And so this is my handout that I use that'll kind of follow along with the videos that I have on here for the nursing process. Thank you and have a good day.